Welcome back. Keep those salams coming in. You can get us, of course, at K24 TV. Let us know how your morning is so far. And also chime in on the discussions we'll be having today, looking at the big story of the day, of course, and the implication it has right across a board. As always, we'll start by looking at the front pages of the dailies, and then I will get to my panel to discuss those big stories, and also now focus more keenly as far as the economy is and where business stands at this particular point. Let's start off with the front page of the People Daily. MPs in London trip panic over corona victim. Legislators and parliament staff who travelled to the UK feared to have had close contact with the latest confirmed virus case. A key story right there. And even as we talk about that, looking at the implications of what's going on from a social perspective, how we interact now already changing from greetings to the vigilance that we are being forced to have. Also looking at implications as far as trade and imports are concerned into the country, travel as well, the quarantines that have been put in place, and also water facilities really essential at this particular point in time. Of course, the entire government emphasizing how important it is to wash your hands every single time because that's a key way in which it is spread. That's the front page of the People Daily this morning. We tell you every single morning right here. It's Kenya's #1 free newspaper. So get it and get fully informed therein. Front page of the Daily Nation. A negative test woman rushed back to ward. After being allowed to leave the isolation unit on Sunday, patient says she developed flu symptoms at night. She tried to call the hotlines provided but could not go through, so she called the taxi, returned to hospital and was readmitted. That's a story that can be found in your copy of your Daily Nation this morning. Even as Kenya confirms 4th case as coronavirus continues to spread around the world, that story can be found as well in the copy of your Daily Nation. On the Standard, it's all about matters, economy matters, business. Freeze taxes to save Kenyans. MPs tell Uhuru. President declares National Prayer Day as leaders and investors ask government to create a crisis fund, suspend taxes and cut back lending rates to cushion citizens from impact of coronavirus lockdown. That's a story that can be found in your copy of the Standard right there. Various sentiments from both parliamentarians and Jacqueline Mugo from the Federation of Kenyan Employees, of course, employers right there, talking about the need to have a crisis fund to cushion businesses. That can be found in your copy of your Standard this morning. Also on the front page of the Standard, radio and online lessons for children at home. Teaching goes virtual and digital as government and schools roll out broadcast and online classes for up to 8 hours daily. So trying to keep some sense of normality even as the children remain at home, making sure they move forward academically as well and still remain mentally stimulated. Ingenious ways been found right there, and that can be found in your copy of your Standard this morning. Front page of the Star, US tests COVID-19 vaccine as Kenya reports 4th case. CS Kagwe asks Kenyans not to panic but take disease seriously. Experts say it will take over a year to get into the market. That in regard to the vaccine currently in trial in the United States of America. And as this happens, of course, the Star covering the fact that Kenyatta leading special coronavirus prayers this Saturday. That's a story that can be found therein. Also in the Star, massive job losses feared as flour exports drop by half, 50%. Just some of the tolls and hits, that are currently being felt as far as the coronavirus pandemic is concerned. Finally, front page of the Business Daily, dividend pay delays as virus stalls AGMs. Regulators start cancelling shareholder meetings on corona spread fears. Where do they move from here? What actually happens as we move forward? That's a story that's being tackled in the Business Daily therein. Also, state offers free cookers, gas cylinders to the poor. This, of course, coming at a very opportune time. That's a story that can be found in your copy of your Business Daily this morning. Let me get to my panel as we discuss the big stories and, of course, shed more light as far as the economy is concerned. Starting from my extreme right, he is the chair of the Radio Africa Group, also CEO of Capital Real Time, Kipono Kitoni. Welcome back.
Thank you, Jeff.
Karibu sana, welcome to the show.
Namaste.
Namaste. It's our new greeting. So it seems. We also have Head of Research, Genghis Capital, Chachilo Gutu. Karibu.
Thank you, Jeff.
Welcome to the show.
Thanks.
Also joined by the chair of the Nairobi Importers and Small Traders Association, Ben Mutahi. Good morning.
Good morning, Jeff.
Welcome to the show.
Thank you.
From a social aspect, you can see how things are changing. Social distancing is now a lexicon we're using every single day. Don't come too near me. Let's just keep our distance as we move on. But also, as you look at the front page of the People Daily right there, MPs in London now in panic over corona victim and how some of them might have been in close proximity with this particular individual. And we know how this particular virus spreads. Some people are asking, is the government doing enough in terms of the measures it's putting right now in place? Because it's sort of like a partial lockdown, just being asked, just stay at home, it would be good, so we don't actually spread this thing. Should they take more stringent measures? We've seen what's happened in Europe and other parts of the world. Should they just lock it down and make sure now is the time to catch it before it becomes a big issue, Kiprono?
On my part, I actually have gone on record for commending the government for being extremely proactive in this instance. In fact, immediately President Kenyatta announced a task force, or rather a team to handle this coronavirus situation. The measures that he announced over the weekend, you know, let's also accept the fact that Kenya has limited resources economically. I mean, we are not certainly in the league of some of the most affected countries. Our healthcare system is not anywhere near what it is in Spain or in Italy. But I would say that a lot of measures have been taken. I've been speaking to my friends in neighboring countries, and without a doubt, I mean, if you look at what's going on across the globe, Kenya is one of the countries that have reacted really positively at the onset, and a lot of measures have been put in place. Social distancing, the work from home measures, the diagnosis and everything. But the one thing that I really would like to emphasize is that, yes, we are talking about 1, 2, 3, now going on to 4 confirmed cases of COVID-19. But the question that begs is, are we really testing enough? Are we diagnosing enough of the potential victims of coronavirus? I mean, we know that in New York City, for example, they are testing 200,000 people per day. In many other parts of the world, they are testing up to 10,000. I think in Kenya, 1 or 2 days ago, they announced that they have tested 200 people in one day. In my own opinion, I think the emphasis right now should be on diagnosis and actually establishing those who may or may not have the coronavirus. Right.
And it's a key point he's raised that there, because we look at around the world with the measures that they're taking. But when it comes back to Kenya, a big question that we have, Churchill, is in terms of capacity. Do we have the capacity to deal with this at this particular point in time, from our healthcare systems to the measures that are being taken right now? And some people are saying, because we do know where we stand as far as healthcare is concerned, probably at this point we should put more stringent measures, have less movement as much as we can, so that we don't have to get to the point where we have to have more than 100,000 people being tested a day.
Yeah, thank you, Jeff, on that question. And I would like to say that our healthcare system is as strong as its weakest link. So if you look at the healthcare system in Kenya vis-a-vis other developed countries, of course we are still lagging in our healthcare systems and in terms of addressing this issue. So as far as it's concerned, I think right now we are just treating it as mostly the cases that people who are coming in and potential contacts that could have arisen from these people who come in from more of the hit countries, Europe or in the US or in Far East Asia. But that said, I think that now we should go to that aggressive measures of trying to look at potential people, because you look at the way this virus is spreading, it's quite exponential. I meet Jeff today, Jeff goes meets another 10 people, and then those 10 other people go meet another 10 other people. So you find that in a single day, there's close to 1,000 people contacted just from one person, or more than 1,000 people contracted. So there's that element of ensuring that people are, that aggressive containment issues, people are, the healthcare systems are quite robust, the test kits are quite numerous in not only the big hospitals, but cutting down to even the county hospitals. So that will be quite key in addressing the healthcare system.
Let me jump to Ben as well on this, because we're coming from a point of view where any single point in time, if you were to stroll down to Nairobi downtown, bustling business, it's not a place where you actually talk about social distancing, because you're moving cargo up and down, negotiating, trading. How's the sense of business now in this particular area with this new measures that are being put in place in terms of even just things like social distance, how we operate?
Well, Jeff, we have seen government acting for the last 1 week or so. But it has been our cry that the election, we saw it from a distance. I remember like a month ago we talked about it. The keeping distance is quite difficult in the downtown because we are a cash economy and we transact on cash. We are trying to tell people, traders, that you should take precautions. But you see, there is a resistance and lack of information. People in downtown, they survive on what they do that particular day. So if you tell somebody not to come to town, and that's where he does, get his daily bread, it's quite an issue.
Right.
So yesterday I was suggesting probably even the health staff, I know they could be overstretched, but we need advisory teams, we need a lot of water in all points, whereby you can get water to wash your hands, which is not available. So we have issues that we really need to address urgently.
Right.
Because the interaction is the distance one thing, you cannot keep, somebody enters you in your shop, he enters into another, and you don't know where he is coming from.
Right.
So we really need to take drastic measures at the moment. Okay. And it's urgent.
Right, right. So this is also an appeal to the Ministry of Health as
yeah,
well.
we appeal to the Minister of Health, CS Kagwe, that probably he could send even a team to just educate and move around, telling people the dangers that are there. You realize some people still have not seen the danger. They are still coming to town, they're interacting, they're going to Malikiti, they're going to River Road, the Nyamakema, all these places, Komba, where we have big populations. And even the matatus. You know, downtown is where all matatus from all directions come from Rift Valley, from Kisumu, from anywhere out of this country. Right. So there is an issue which needs to be addressed, because that's where the population that moves up and down is.
Right. Yeah. And we're talking about this from a two-pronged approach, Kiprono, because on one hand we're talking about ignorance, some people not getting the gravity of how this might spread, saying that before we had the story that, you know, we are Africans, we don't get corona. That has since been disproved, but also there's a point of view where, even as CS Kagwe says, let us not panic but take disease seriously. Front page of the Daily Nation raises a couple of questions with a woman who tested negative but had to be rushed back to the ward, and the question comes back to, are we testing accurately enough? That had also been raised back a while back, and people now wonder, in terms of the confidence, are we confident in what is being done in these isolation units? Because she goes home one day, seems like something had, you know, slipped through the cracks.
You know, Jeff, I think we all need to acknowledge one thing, that we are living in historic times. We are facing an unprecedented challenge. I don't think the world in living history has ever been in a situation like this, where we are actually facing a potential lockdown, where even interaction between family members within the family units has to change. Interaction between employees and organization has to change. Interaction with the general public, as my friend here has said, has to change. I mean, going to the marketplace as you've always known it, we've got to think differently. And if we look at what's going on in the world, I mean, look at the United Kingdom, for example. The initial reaction and pronouncements by Prime Minister Boris Johnson was an almost casual approach by the United Kingdom. But within a span of less than 1 week, the situation has significantly changed. I watched him on TV yesterday, speaking with his scientists. You know, a few days ago, Boris Johnson, I mean, the scientists in the United Kingdom were talking about something called herd immunity. And they were sort of running with a thinking that there would be a broad-based immunity by people in the United Kingdom, which has proved to be a sham. We've seen Prime Minister Cuomo in New York City. More locally here, we've seen the pronouncements by Governor Mutua. We've seen Governor Paranya closing morgues. We've seen Governor Joho take very extensive steps insofar as what needs to be done. And I think here we need to look at it from two points of view. One is the corporate measures, the institutional measures, where you work, what's the reaction of the organization that you're in. As businesses, for example, in the last 2 days, I have been seriously doing business continuity measures in my companies. I've been actually conducting activities that will allow our business to continue, notwithstanding the challenge of coronavirus. Personally, in the homestead, you have to change the way that you live. I have a child coming in tomorrow from the United Kingdom. We are told that they must have self-quarantine for 14 days. So that you have to talk to the rest of the children in the home insofar as how you interact with that child. Not because that child has coronavirus, but then it is a measure that the World Health Organization has pronounced and we as a country have embraced. And we should not take it casually. So that also impacts on the way that child interacts in the house. And then there are also the social issues. There's the socialization of it all. You know, explaining to that child that this is what it is, and we're not, you're not being ostracized because of any reason, but then that is the way it should be. And I think that we really have to take this thing with all the seriousness it deserves. We need to enhance our ability to diagnose. We need to look at the concerns. I think yesterday in the newspaper we saw a complaint about the way those who are in isolation and those who are being treated are being handled. And of course, we have to be very, very sensitive to that reality. That assuming, for example, Jeff, you started to develop symptoms and you went to a hospital and then you were rushed into isolation, and then from isolation, perhaps if you tested positive, you went into a treatment regime. How are those people being treated? And I think it's really important that they're being treated to global best practice standards.
Right, and that's a key issue and concern right there. I'll move to Churchill, because even as we talk about that, there's also the fact of what's happening in terms of the economy, and very many people have been worrying on this particular point in time. You've been crunching the numbers, you've been looking at this as it plays out. What has been the biggest concern from the data you've been distilling so far?
I think the biggest concern is now issues to do with now revenues. Remember that the government collects taxes from businesses, from individuals, and because of all these aggressive containment measures that are being put in place, there's that knock-on effect on businesses, as Ben had alluded to earlier on. And so we're looking at most of the businesses are coming out with some pronouncements that there could be a freeze in some taxes, could be suspended because of looking at all these things coming together, or there could be a bit of most of the taxes in place, things like customs and other import duties, they account to roughly 10% of the taxes that are being raised. So we are looking at around 170 billion in the course of this financial year ending in June. So what we are seeing is that it could be like a multi-pronged approach, whereby, yes, the businesses on one hand are demanding all these kind of incentives or tax breaks in the interim. But then again, we need to look at the other side of it, because Parliament or National Treasury, they are the ones which approve the budget for any particular year. So there could be that kind of a supplementary budget which could be adjusted to reflect this knock-on the negative impact of slowdown in revenues for the remaining part of the year. And what we are seeing, even which was quite surprising to me, is now MPs have gone for a recess for another 1 month. And we could expect some of these policies to be put in place by MPs so as to be able to see businesses having these tax breaks in the event that we don't have an executive order by the president. But in this scenario whereby MPs have gone on recess, we are left at where the businesses on one hand are demanding all these things, but you don't have a body to implement these things. So that's quite a concern for me. Unlike other nations, whereby in the UK, for instance, there's a COVID bill whereby they are coming up to the tune of 330 billion pounds. That's around 45 trillion shillings. That's 5 times our GDP in any given year. So those are some of the extent that some of these developed nations are going. But now we don't have that mechanism in the country, and that's quite a concern where I'm sitting at.
What's a concern from the Nairobi Importers and Small Traders Association? Just one big concern even as we get into our break.
Jeff, you realize that we are coming from a situation whereby China itself, which surprised most of the African countries, and in this case particularly Kenya, they were on recess, they were on their holiday, New Year holiday, and then immediately the coronavirus started moving out of China and the world now. So in the first place, we don't have any imports. We don't have goods. And then the little that is there, you're now trying to survive on it. So if the government can come in and remove some of the taxes, whatever little that arrives in this country, even from a different source or from a different market, taxes should be considered. If you look at some of the chemicals that we are using, the sanitizers and the rest, they are still taxed. And now they are also getting out of the market. So if you go to any supermarket or even to a chemist, they are not there. So how are we going to survive? So some of our considerations that we may request the government to do is to waive taxes, probably even go to an extent of talking to the banks, because most of us are small loans, and as traders, we had borrowed, assuming that we will import. Then the other issue is about we have electricity bills that we are paying, we have water bills. The government should come in and probably give a waiver or a way forward whereby all these traders who contribute to the economy at least are assisted. As I said earlier, we are on a cash economy. Our service is to wake up early in the morning, go make something, go home, feed your children and also pay school fees, and also we have employees. If today we close, what is going to happen to our employees?
The ripple effect of that.
Yeah.
Okay. Keep on before we get to our break. From a captain of industry perspective, what's keeping you up at night now? What's happening?
You see, what's keeping me up at night is the fact that, of course, there is going to be an economic slump. And like you earlier said in your opening remarks, I mean, our economy wasn't firing in all pistons. And right now we are facing a situation where there's going to be a big slowdown in almost all fronts of the economy. And even the measures, you see, as businesses, of course, as business leaders, we will be advocating for certain measures to be taken by government. But even those have consequences. If we propose to government, for example, tax cuts or things like that, then the impact will also be felt. Right. But then I think for me right now, it is for all stakeholders to sit around the table and actually come up with solutions. One of the solutions that I saw yesterday, and I was very pleased, is the decree by the government that all water companies should make sure that all the taps are flowing with or whether or not bills have been paid. Right. Water is the main source of primary health care. I mean, if you don't have water, there's no way you're going to, keep your hygiene standards up. But I think one of the things that also keeps me up is the opportunities. You know, we have a problem, and we've acknowledged that we have a problem. The problem has been defined. It is a global problem. It's not a Kenyan problem. This is a time as a country we should look at our own competitiveness. Right. We have been losing track insofar as regional trade is concerned. Our major trading partner, Uganda, today has a bigger trade surplus. They have a trade surplus over Kenya. And 20 years ago, the trade ratios were 20-1. Right. So we've lost out in Uganda. So this is a time for our manufacturing industry to look at its own competitiveness. This is a time for us to, we pride ourselves as Kenya to be the digital savannah. These are our time to look at our online sales capability, the opportunities in logistics, deliveries, last mile deliveries, telemarketing. This is the time to look at our healthcare system. You know, the president made healthcare one of the big four agenda, universal healthcare. I've been a big critic of the way it was executed. Right. You see, the whole thinking behind, universal healthcare is fantastic. But then I think as a country, you know, people love making money in Kenya. We went into procurement mode. So we've gone around, we procured the best equipment. It's all over, sitting all over the country, and now we are struggling to get people to start to use those equipment. Okay. People forget. Healthcare is primary. It is the most basic thing that you do. It's access to clean water and sanitation. Okay, we're going to take a short break at that particular point in time. When you come back after the break, we jump more into the business implications of COVID-19. How do we move forward? How is the business community specifically affected by this? Lots of people asking the government to take different measures. Some are waiting for that stimulus package. But the big question is really, where does the money come from for all of this to happen? That and more after the break.